Surgical sperm retrieval is a method of getting sperm out of either the testes or the epididymis, which is a structure attached to the posterior, the back aspect of the testes, which stores sperm, in patients who may have either obstructive or non-obstructive lack of sperm in the ejaculate. Normally speaking, every attempt is made to increase the chances of couple having natural fertility, but if for whatever reason is unlikely, then surgical sperm retrieval is undertaken. Some of these men will benefit from having reconstructive surgery where sort of natural fertility becomes possible at a later stage. But if that's not possible, then surgical sperm retrieval is undertaken where we either use simple procedures such as using a needle to aspirate sperm from the epididymis or from the testes, and moving on to the more advanced procedures such as an open or a micro TZ, which is testicular sperm extraction. It's the method that we perform in our unit, which is the gold standard treatment option for men who suffer from non-obstructive azoospermia, where the testis is opened up, and using a surgical microscope, the most healthiest of the what we refer to as seminal tubules within the testes are extracted, and we have an embryologist who's in theatre with us, who then analyzes that sample for any presence of sperm. So we take samples from different parts of the testes, and once sperm is found, if any sperm is found, then we take more samples from that particular pole of the testes, and then subsequently those samples are either frozen for later IVF type of treatment, or if it's planned, it can be eggs can be from the female partner can be simultaneously collected, and IVF XC type of treatment can be performed at the same time. The simpler procedures, what I refer to with, they're performed with needle, they're referred to as a teaser or a PISA procedures, and they can be performed under local anesthetic or some sedation, whereas the micro TZ procedures, which involve more surgical input, are performed often under general anesthetic. So surgical sperm retrieval is an umbrella term used for several different procedures that we perform to get sperm out of either the testes or the epididymis. The simpler procedures, which use a needle to aspirate sperm either out of the epididymis, which is the structure behind the testes, attached to the testes, or from the testes itself, are often performed for the type of absence of sperm in the ejaculate, which we refer to as obstructive azoospermia, where at some level there is a blockage, where there is lots of sperm in the system, but it can't get out. And therefore, simply sticking a needle in those organs, we can get the sperm out, which can later be used for IVF XC type of treatment. Whereas for the men with azoospermia, so men who do not have any sperm in the ejaculate, in whom we think they're suffering from non-obstructive azoospermia, which essentially means we don't think there is a blockage, and that there may be a problem with production of sperm, but the type where we think there may be some sperm in some parts of the testes, small numbers, but there may be, we perform a microsurgical procedure called a micro-TZ, micro-testicular sperm extraction, which is a procedure performed under general anesthetic. And within the testes, we, using a surgical microscope, we look for the healthiest tissues, healthiest tubules within the testes, and then those samples are passed on to an embryologist who's in the operating theatre with us, who then analyzes those samples for presence of sperm. And if sperm is present, we collect more samples, and then they're frozen or used simultaneously after the partner's eggs are collected for IVF XC type of treatment. The micro-TZ procedure is, as I said, is often done under general anesthetic, whereas the needle procedures, which are often performed for obstructive azoospermia, are performed under local anesthetic, sometimes with sedation. It's important to me to say that in patients who have obstructive azoospermia, we normally make every effort to try and reverse the obstruction by performing reconstruction and enable couples to have natural fertility later, which is more acceptable to most patients, and also in some cases is less costly for them, but it's not appropriate in all patients, even if they do have obstructive azoospermia, for several factors, including both male and female factors. So the simpler forms of surgical sperm retrieval, referred to as a teaser or a peeser, which are the needle procedures, are relatively straightforward, and if they're done under local anesthetic, they can be done within 15 minutes. Whereas the microteasy procedure, which is often done under general anesthetic, or at least in my practice, done under general anesthetic, takes a little longer, somewhere between 30 to 45 minutes. And again, it depends on whether we manage to find sperm from the first testes, which makes the procedure quicker. But if it's not found in the testes, we often open up the second testis and look for sperm to give the patient the best chance of success, which will ultimately make the procedure a little longer. Again, I think, as I've already said, surgical sperm retrieval is an umbrella term for several procedures. The needle procedures are tolerated well under local anesthetic in most patients, and usually, as long as there is no complications, which are quite rare, infection or bleeding, after several hours with some simple painkillers such as paracetamol, there isn't much discomfort. Whereas with the microteasy procedure, there will be a bit of discomfort for the following 48 hours, and again, the majority of these patients are managed. The pain is managed by taking simple painkillers such as paracetamol or ibuprofen for a day or two.